This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo. Recently on the program, we've talked about the use of genetic testing in detecting a patient's risks for cancer. This week, we'll talk with someone who benefited from genetic testing.
I was in my 20s when my mom was diagnosed with cancer.
That's Sarah Brady.
I understood the screening she had to do, but she was my mom. She was older. I wasn't thinking, I'm going to have to get screened tomorrow or anything like that. I was in my 20s. I was healthy. I wasn't worried about it.
But one day, Sarah's sister called. She had gotten genetic testing to assess her own cancer risks.
Once my sister called me and said, I have this gene, and I started doing some research on it, that moment sparked my interest in what preventative screening for breast cancer could be. And I knew I needed to get genetic testing to be able to make a good decision about what type of screenings I needed and what frequency I needed going forward.
Part of the reason Sarah understood the dynamics here is that she is a nurse, whose husband is also a nurse. But she says with good testing and a good care team, anyone could navigate this situation. This week on the program, Sarah shares her story.
In 2010, about 5 months after I married my husband, my mom was diagnosed with stage 2 breast cancer, and it was highly aggressive, triple-negative breast cancer. She was 55 years old at the time. She was working as, I believe, a vice principal of one of the schools here in town. She'd been an educator for 30 years here in the Kingman area, most of that time. So in October, during Breast Cancer Awareness Month, the school district brought in the van for all the teachers at the school to have their mammograms completed. She had had a mammogram done the prior June. So just a few months earlier, she had had a completely negative routine mammogram completed. In order to set a good example for all the teachers in her school, she went on the bus and got her mammogram done again, even though she wasn't due and didn't need it yet. And that showed something that wasn't there before. And so as the workup continued through the health system, she discovered that she had this stage 2, very rapidly growing breast cancer. If she hadn't gotten that test in October, she would have been far advanced by the time she showed any symptoms. Completely a blessing that they had the van there and she was able to capture it. But she had to go through a lumpectomy, biopsies, having a port placed. She had to get months of chemotherapy and months of radiation and ended up making a full recovery. But the process is ugly. It's not fun. It comes out of nowhere, it seems like, and you're just really, really ill while you're trying to fight this thing. So I'm grateful that she had that done and had that tested and that she was able to make a full recovery from that. She's since passed away in 2018 from a different unrelated illness, which was awful. But at that time, my older sister, who lives across the country, decided to get genetic testing done to see if we had the BRCA gene. And what made her do that is watching my mom go through the, cancer diagnosis, the chemotherapy, but also on my mom's side of the family in Southern Illinois, she had multiple aunts, a sister, nieces, cousins, and a significant percentage of these women in their 50s all had aggressive breast cancer diagnosis. And so my sister did this testing and was positive for the BRCA2 gene. She called me and said, you need to get tested. So thankfully, my husband worked at a cancer center at the time, and he kind of said, you need to make an appointment with Dr. Rivera. I know that we do that here, but I don't really know all the information about how that beginning part is done. So let's do that.
This is a good moment to hear from Dr. Rivera. He's the Director of Oncology Services at KRMC, and here he is to clarify a couple of terms.
There's a difference between having a genetic cancer versus hereditary cancer. So all cancers are genetic, right? So remember, cancers are just normal cells that change over time. They go through genetic mutations and they lose their ability to die. So technically, all cancers are genetic. The question is whether the cancer is hereditary, whether the person was born with a genetic predisposition to develop cancer.
So I met with Dr. Rivera, who is amazing, so efficient, so intelligent, great bedside manner, just wonderful. I can't say enough good about the man. He was wonderful. He ordered me a test. They mailed it to my house. It just required a spit sample and cheek swab. I mailed it back out and got my results, which said that I had the BRCA2 gene as well. And that's what sparked this whole healthcare process. His recommendation was, decide if you're finished having children. You really should have a double mastectomy, and you should consider having a hysterectomy and ovaries taken out, so an oophorectomy as well. My husband and I gave that a lot of thought and a lot of prayer for probably a year before we made a decision together that this was the right thing to do. I did not want to go through this, what I watched my mom go through, what I've watched so many other women go through, both in my family, in the community, everywhere, especially at a young age, because my mom was in her 50s, but you see women in their 40s and 30s and even 20s now being diagnosed with breast cancer. But there's ways that you can get yourself checked and do the preventative things. So started the process with all of these providers, met with my GYN at the time, was Dr. Tedesco, and talked with him about the hysterectomy piece of it. I was in my early 30s, already had 2 kids. We knew we weren't having, any more children, so family planning wasn't an issue for us. Had to meet with a plastic surgeon and then a breast health surgeon as well, and she was in Sedona. So it took about a year in getting appointments with all of those specialists, meeting with all of them, discussing what I should do, what is their recommendation, what would testing look like if I didn't go through with having surgeries. And at the time, and it probably still is the recommendation, I would have had to have a mammogram and a breast MRI every 6 months, like overlapping. So I'd have a mammogram, and then 6 months later have the MRI, and then 6 months later mammogram, and then 6 months later MRI. And I really didn't want to do that. I had several mammograms, but I did the MRI once, and I just thought, this really isn't worth it to me because the risk is still there. I'm just being screened more frequently, which is great. So decided to move forward with planning surgeries. And in January of 2020, I had the double mastectomy first. And I needed to have that first because I was still very young and my docs were really not wanting to put me into early menopause. So in order to not go into early menopause when you have your uterus and ovaries taken out, you have to be on hormone replacement. You can't be on hormone replacement, or shouldn't be, when you have breast tissue, because that can actually increase your likelihood of growing cancer. So that had to be done first. So I did that first. I had that done in Sedona, and I had to coordinate with the plastic surgeon at the time. Everything went beautifully, beautifully. I cannot say enough good about that experience, but it took 8 weeks to recover before I could go back to work. So we really had to plan well, my family and I, which we did. I was able to go back to work since then. So 5 years down the road, I did have 2 small revision surgeries from that, and then nothing else. It's all good after that. So that was January of 2020, the first one. In November of 2020, I had the hysterectomy and oophorectomy, so uterus and ovaries taken out. That was done here in Kingman. Great experience here as well. Can't say enough good about the surgery team, about my doctors, my nurses, all the surgical staff. Everything was great. And then I was able to start hormone replacement after that. I have had no issues with any of that since then. I have extreme peace of mind after all of that.
It's beautiful. We hear again and again how patients have to be their own best advocates, how they need to know some things. They also have to be careful with Dr. Google because they can go down the wrong rabbit hole. So there's a balance here. But you had this advantage going through this process, and you and your husband are both nurses. How did that affect this whole journey for you?
We had an advantage in that we knew what to expect from the medical teams. And we knew what being a patient inside the hospital looks like. Our expectations were high. We take pride in our own patient care. And so we had very high expectations of the care that we would receive. Every place we went to met those. We also have the benefit of seeing what the end result is when patients and people do not follow the screening procedures that are recommended and let something go for a long time, and then what it looks like to be treated medically when something's advanced. And it's just not pretty. It takes something away from you. And so I think our decision was, we know what it looks like if you don't do this, and we know how much the risk goes down if you do. So it made it an easy decision for us. Luckily, we had great teams caring for us.
You said this whole process had to be coordinated carefully because it has to do with the removal of tissue and the presence of hormones and then replacement therapy and all of this, right? And it went really well for you. Again, if you were somebody who didn't have any specialized medical knowledge, would it have been able to follow that, or were you able to arrange it better?
I don't know that it would be any different, because I think once you take the step of the first asking the questions, get me the genetic testing, especially in talking with Dr. Rivera, because his approach is so well-rounded that I knew exactly where I needed to go and who I wanted to talk to and the information I wanted to continue to gather before making a final decision. I think anyone can do that. You don't have to be a nurse to do that.
Yeah. You said you had the advantage of knowing what it looks like when people wait too long. And we have so many efforts for outreach in the community in terms of the Catch It Early program and trying to encourage women to get their annual screening mammograms. And yet we still run into this, and I know you've heard it, where women will say, I haven't been in a while because I don't want to know. Or we have a history in the family and I'm afraid what I'll see if I go get screened. This kind of thing must make you crazy.
It does. We're in charge of our own health, and I don't believe in operating out of fear. That's just not in my person to be that way. I understand, though, when you've watched loved ones go through something that just seems so ugly and so stressful, that it's easier to just say, I don't want to know. But it is much easier from my experience to do that. And then if it's a bad answer or something pops up, you got to go through it. You can't avoid it.
Yeah. I want to ask you something personal, and I have your blessing about this, but the removal for a woman, the removal of her breasts, of her ovaries, of her uterus. You said you were done having kids, and you talked about it at home with your husband, but that must have been, did you feel like some part of you was missing? Something integral to you was missing after all that?
I really didn't.
No.
I really didn't. I knew what I was doing was going to allow me to be with my kids and my family longer, and for them to potentially not have to see their mom sick. So I think I didn't feel like a part of me left. Those parts had already served their purpose in the creation of my family, so they had done what they needed to do, and it was okay for them to go. And it was more a commitment to me being with them longer than me grieving something that was leaving. And that's not necessarily the case for every person. That's just my own personal take on it.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Sarah Brady. She's sharing her experience with genetic testing to detect the risk of cancer. In preparation for our chat today, I was reflecting on how, for some reason, when we talk about, even in 2025, when we talk about gynecology or urology or breast health, we have to whisper, because somehow it's like half of us have male genitalia and half of us have female genitalia, and still somehow it's, we don't talk about that, don't we? Right?
Yeah.
But like, you're doing the good work by sitting here and talking about this today. Have you had the opportunity in the years since you went through the procedure and this whole process, have you had the opportunity to talk with other women or other families about this?
Yes, particularly a handful of women over the last 5 years or so. I have never been secretive about this story because I know that it's different. It's not the choice that everyone makes. It was the right choice for me. But other women have things pop up when they are getting screened or they decide to do a genetic test and they're looking for, has anyone been through this? Right? That's what you wonder. And that's kind of why you whisper is like, how do you ask that question?
Am I the only one?
Am I the only one? You can feel very alone. So I put my story out there. I told people I worked with what was going on. I told my family what my decision was, my church family. And I had people in my corner. And over the years, I probably had half a dozen or so women that would find me either on social media or at work and just say, hey, I heard that from so-and-so that you had this done and I have this thing going on. And can you talk to me about what your experience was like and why did you decide to do that and how did you decide to do that? Always, 100%. But all of those conversations have been one-on-one with a woman, with a single woman. So in this case, us sitting here talking, the story may reach tons more women out there and actually make an impact on them and what they decide to do. Maybe some people will be encouraged to go just get a preventative screening done.
Yeah.
And that would be huge. But I think it's meant something to the ones that I have spoken with over the years. A few of them had cancer and had to have total mastectomies and were struggling with that. And there are others that just had the gene and they don't know how to reconcile that. They may be in a different family planning phase of their life. And, the docs will kind of make recommendations, but you're empowered to make a decision for yourself. What's right for you? What's right for your family?
Well, speaking of those women who came to you and you were able to talk with them, of course, we will respect their privacy, but how do those conversations tend to go?
I would say the women were scared. By the time that they were reaching out to someone like me, you have to get to a certain point of realization to be able to say something like that out loud. And so they had clearly wrestled with it personally, and then got to the point where they were ready to say out loud the thing they were scared of. So I commend people for doing that. I know that fear. But by the time they got to me, they were ready to really gather information and talk and just kind of be loved on that it's okay to ask some of these questions. And there are people out there that can help, that have been through some of it, that can offer some perspective. Happy to do it.
Again, it's that thing about having to whisper. It's such a shame that we have to whisper about these things.
We just don't have
We're
to.
just human beings.
Yeah.
It's okay, everybody. We'll figure it out. You told me that having gone through all of that, you have 1,000 tips and tricks for women. Can you share some of the best ones?
So the tips and tricks that I was talking about have to do with little things you don't think of when you're coming home recovering from these types of surgeries. So the first surgery, when I had the double mastectomy, I had a pain pump that was, inside that had to come out at a certain point with a little purse that came with that. I added some little safety pins and buttons to that so that it stayed in place and I didn't have to wear it around my neck all the time. So that was a really good pro tip. The other thing that I had talked to another woman who'd had something like this done, and she recommended this. It's essentially a belt with a clip on it that has 2 cotton pouches for the extra drains that they can sit in because they can't just be dangling off of your clothes. And so I wore that little belt around for 2 weeks before those drains were able to come out. Hugely helpful. Same in the shower. Buy a lot of dry shampoo because you will not be able to reach your head for a few days. Anything in your house that's above waist level that you might need, move it down before you have surgery. And an example of that was I couldn't reach the bowls in my cabinet that were in a tall cabinet. And I wish that I'd had them on the counter so that I could make myself a bowl of cereal. Little things like that you just don't think about for a month probably. I couldn't raise my arms above my shoulders. And so anything that you would need, move it down before you do that. Other couple of things is with the hysterectomy, I had an awesome body pillow. Loved that in bed. I put steps up to my bed because you don't realize how much you use your core to get in and out of bed. And so just some little things to help you in and out when you're by yourself are hugely helpful.
Sarah, if a friend of yours came to you and said, I just had genetic testing and it showed the BRCA gene, and what kind of advice could you offer me? What would you say to her?
My initial response would be to just be there. Sometimes it's just, I understand and I'm here. What are you thinking? And depending on where they're at in that discovery process can change kind of what they need to hear in that moment. But if they were said specifically, what is some advice that you can give us? I would say start scheduling some appointments to gather information. And once you have all the information, make yourself a plan. What's right for you? Is it screening every 6 months for a number of years until whatever time comes? Is it, no, I think I want to move forward and start going down the surgery path? Great. I can help point you in some directions for that and give you some encouragement. Even though you have the BRCA2 gene, it doesn't mean that you have to do something today, but you do have to do something soon. So whether you make a decision to have screenings done or you make a decision to have surgery, you don't have 5 years to make that decision.
Sarah, you've been so open, and so one more personal question, if you'll allow it. What does the future look like? What does the prognosis look like now?
For me personally?
Yeah, having gone through all this.
I don't remember the exact numbers, and I don't 100% buy into all of the, you have a 90% chance statistics types of thing. But I knew that I had greater than an 80% chance of getting an aggressive breast cancer at a young age with the BRCA2 gene. I knew that I had probably a greater than 60% chance of getting uterine or ovarian cancer. After the surgeries and talking with my doctors, it's down to like less than 1 or 2% chance. The in between those numbers is where it was at for me. If I go from a 60 or 80% likelihood to have a diagnosis of cancer with the treatment plan that the docs had given me, and then to be 1% or less chance of getting all these things, it was totally worth it to me. Shameless plug from a nurse of 18 years and in healthcare for 24 years to anybody listening, whether you are a woman, a husband, kids, grandma, grandpa, whatever your title is in your family life, if you have women in your life between the ages of 20 and 60, encourage them to take ownership of this part of their health. Go talk to somebody. Go talk to a medical professional, get a recommendation, and then make a decision. And just know that whatever the decision is that you make, as long as you're getting screened and being checked, even if it's self-checks and mammograms for the rest of your life, that's enough. That's enough. Just pay attention to it and try and avoid being the person that strikes, if you can.
That is Sarah Brady, RN. Sarah, I can't thank you enough for this conversation.
Thank you. It's been great.
For more information on genetic testing at Kingman Regional Medical Center, please call the W.L. Nugent Cancer Center at 928-692-4666. That's 692-4666. And that is the program. That's Focus on Your Health. I'm TG LaFredo. Thanks for listening. We'll catch you next time.